Here's some language I use as a midwife when providing care. I like to use the word contraction and surge kind of back and forth. The word surge to me sounds more like a surge of energy. It sounds more empowering. And I'll say contraction like if the client doesn't know what I'm talking about, or their partner or something. I use the word birthing mama, birthing person, birth parent. I like this because I feel strongly about the resurgence of the matriarch, and I really want to honor the maternal figures. And also, I want to have inclusive language for my gender nonconforming siblings that are birthing. And so I like to just use all of those interchangeably. I like to use the word chest crawl for how the baby, when they're a newborn, they crawl up to find the nipple and start nursing. I like chest crawl because all the babies have a chest and they're trying to latch. So what else? I like to use the language, the water opened, instead of saying like her water broke, because it sort of sounds like a negative thing. And I feel like, like a door needs to open before, we can go through it. I like to feel more positive about saying opened, but I will say the water's broke too. I use the word yoni because I don't, it's the only Sanskrit word that I know or use, but it's just the only word that I've ever heard that sounds respectful to that part of the body. People really aren't feeling the word like, vaginal introitus doesn't really sound as good. And yoni is kind of a quick way to say like respectably talking about, the part of your body where the baby comes out. The word postpartum. I notice that whenever I say postpartum, referring to the time of the cuarentena, the 40 days after birth, I feel like a lot of people think right away I'm talking about depression, and I'm not. So like postpartum depression is one thing, and the postpartum time is a different thing, but I understand how sometimes people are talking about depression when they say postpartum. That's just a few. I know there's a lot of other words that we use differently than the hospital system because we have like a different mentality and lens when looking at childbearing. So let me know, what do you think?